Hello and welcome. Today we're diving into the complex world of neurotoxicity, a condition that affects the nervous system's delicate balance and function. We'll explore what causes it, how it manifests, and what can be done to manage and prevent it. So, let's embark on this journey to understand neurotoxicity. Neurotoxicity arises from exposure to various toxic substances, often called neurotoxins. These can be naturally occurring, like certain heavy metals or plant toxins, or synthetic, like industrial chemicals, pesticides, and even some pharmaceuticals. Exposure can happen through inhalation, ingestion, skin contact, or injection. The severity of neurotoxicity depends on the specific toxin, the dose, the duration of exposure, and individual susceptibility factors, such as age, genetics, and pre-existing health conditions. At its core, neurotoxicity involves damage to neurons and glial cells, the essential building blocks of the nervous system. Neurotoxins can disrupt various cellular processes. They might interfere with neurotransmitter signaling, leading to either excessive or insufficient neuronal activity. They can also impair energy production within neurons, damage cellular structures like the mitochondria or DNA, or even trigger programmed cell death, known as apoptosis. Inflammation and oxidative stress often accompany these processes, further contributing to neuronal damage and dysfunction. This cascade of events ultimately disrupts the normal functioning of the brain, spinal cord, and peripheral nerves. Determining the exact global prevalence of neurotoxicity is challenging due to the diverse range of potential neurotoxins and exposure scenarios. However, certain populations are at higher risk. Occupational exposure is a significant factor, affecting workers in industries like manufacturing, agriculture, and mining. Environmental exposures, such as contaminated water or air, can also impact communities. Children are particularly vulnerable because their nervous systems are still developing and their detoxification mechanisms are not fully mature. Understanding these at-risk populations is crucial for implementing targeted prevention strategies. The signs and symptoms of neurotoxicity can vary widely depending on the specific neurotoxin involved, the affected areas of the nervous system, and the severity of the damage. Common symptoms include cognitive deficits like memory loss, difficulty concentrating, and impaired decision-making. Motor problems such as tremors, muscle weakness, and coordination difficulties are also frequently observed. Sensory disturbances, like numbness, tingling, or changes in vision or hearing, can occur. Additionally, neurotoxicity can manifest as psychiatric symptoms such as anxiety, depression. In severe cases, seizures, coma, and even death can result. Diagnosing neurotoxicity can be complex, often requiring a comprehensive evaluation. This typically involves a detailed medical history, including information about potential toxin exposures and relevant symptoms. A thorough neurological examination is essential to assess cognitive, motor, and sensory functions. Neuroimaging techniques such as MRI and CT scans can help visualize structural changes in the brain. Blood and urine tests may be used to detect specific neurotoxins or biomarkers of neuronal damage. Neuropsychological testing can provide a detailed assessment of cognitive function. A combination of these diagnostic tools helps determine the extent and nature of the neurotoxic damage. While a broad classification isn't always possible due to the diversity of neurotoxins, neurotoxicity can be categorized based on the affected area of the nervous system. For example, peripheral neuropathy specifically targets the peripheral nerves, causing symptoms like numbness and pain in the extremities. Encephalopathy refers to a more generalized brain dysfunction, leading to cognitive and behavioral changes. Another way to classify neurotoxicity is by the type of toxin, such as heavy metal neurotoxicity or pesticide-induced neurotoxicity. These classifications help tailor treatment approaches and predict potential outcomes. Treatment for neurotoxicity focuses primarily on removing the source of exposure and managing the symptoms. If the neurotoxin is still present in the body, chelation therapy, which uses medications to bind to the toxin and promote its excretion, may be employed, particularly in cases of heavy metal poisoning. Supportive care is crucial to address specific symptoms and improve the patient's quality of life. This may include medications to manage pain, seizures, or psychiatric symptoms. Physical and occupational therapy can help improve motor function and daily living skills. Cognitive rehabilitation can assist in restoring cognitive abilities. Early intervention is key to maximizing recovery and minimizing long-term complications. Prevention is paramount in mitigating the risk of neurotoxicity. This involves identifying and reducing exposure to potential neurotoxins. In occupational settings, this means implementing safety protocols, providing protective equipment, and monitoring worker health. Public health initiatives can focus on reducing environmental exposures, such as ensuring safe drinking water and regulating pesticide use. Educating the public about potential sources of neurotoxins and promoting safe practices is also crucial. Additionally, Promoting healthy lifestyles, including a balanced diet and regular exercise, can enhance the body's natural defenses against toxins. The prognosis for neurotoxicity varies significantly depending on the specific toxin, the severity of exposure, the timing of intervention, and individual factors. In some cases, with prompt treatment and removal of the toxin, full recovery is possible. However, in other cases, particularly with severe or chronic exposure, permanent neurological damage may occur. Recent research is focused on developing more effective treatments for neurotoxicity, including neuroprotective agents that can protect neurons from damage and regenerative therapies that can promote neuronal repair. These advancements offer hope for improving outcomes for individuals affected by neurotoxicity.